Interesting topic of conversation. It's something that's been in the headlines, something that we are hearing a lot more about. And we're talking pain medications, but we're talking OxyContin and Fentanyl and all of these things that come under this umbrella that really we need to be talking about. And joining us is Dr. Ujjainwalla, who is an addiction medicine specialist. Great to have you here on the show.
Thanks for having me.
I was surprised when I read the statistics. More than 200,000 Canadians are addicted to prescription type pain medication. This is a big umbrella, though. Can you break it down a little bit for us?
Sure. Well, firstly, that's a shocking number, 200,000
Yes.
Canadians. That's like one person dying a day from this. There's 300 to 400 accidental deaths from this drug a year, and so that's one a day. So addiction in a broad sense, opiates in a broad sense, you hear OxyContin, you hear fentanyl, you hear morphine, Esalen, they're all the same drug. They're basically a depressant drug that you get quickly addicted to, meaning that if you take it, you get a tolerance, and then if you don't take it, you get a withdrawal. And the kids that are taking this with alcohol, the added effect of the depressant drug affects your brain, and you can't breathe. So it's a very, very dangerous drug. You can die very quickly, even the first time you use it. If you're at a party and you try it, and it's a tragedy, and it's just so such a bad thing.
We're seeing this on a very tragic level when it's happening to a much younger generation, as we've heard with the storylines coming out of Manotick. But you know, how else is this coming into our lives? Is it someone heading in for surgery and then been given pain medication, and the next thing they know, they can't get off of it?
You're right. Look, a good example, if you broke your arm and you went to the hospital, you have legitimate use of, say, Percocet, and when you leave, they give you some Dilaudid to take home, and after a while, you keep taking the Dilaudid, and you take it for other reasons, and the next thing you know, you get a tolerance to it, and your doctor gives you more and more and more, and then one day, they won't give it to you, and now you're stuck, because you're going to have to get it off the street or illegally, and some of these people have $100 to even $1,000 habits to get this drug off the street, and that's where all the crime comes in, because they have to get the drug, because if they don't, they go into withdrawal and they feel horrible.
The one thing that you were talking about is us switching our mindset and looking this similar to a disease. The disease the disease is where, how do we need to change our focus to look at it like heart disease or dealing with a cancer when we are dealing with this?
Right, so that's the most important thing, and I think what all the viewers have to understand is that we're talking about the disease of addiction. Just like we have heart disease and just like we have cancer, we have a great problem in our society, and it's addiction. And this is a disease. This isn't a bad choice. And so what we need to do is focus on the solution of that disease, which is really putting people into treatment centers and putting people into facilities that will help them rather than putting them into jail, which doesn't work.
Can we really quickly talk on this Operation Kentucky, because you've transferred this into Operation Ottawa? Yeah,
so what it is recovery. We're calling this Recovery Ottawa, and we have a group of concerned people, including judges and lawyers and police and physicians. And what we want to do is change the federal government's position on putting people in jail as the treatment of addiction, and we know that doesn't work. 100% of people who go to jail reoffend. If we put you in a treatment facility, 65% of people who go through our program will not reoffend, and it'll be 1/10 of the price. So it makes sense for everybody.
For you, and you're dealing with this, what is the best course of action when you're starting to deal with a patient coming in who may have, and you're saying the stories of how this unfolds is remarkable. Everyone's got a story.
Yeah, and everybody is affected by this. The disease of addiction is alive and well, and it's rampant all over the place. It's National Addiction Awareness Week this week, but most people, because they're ashamed and embarrassed about the whole thing, they don't really talk about it. And what we want to do is start putting it in the forefront and come up with really healthy solutions where we can take people and stop the suffering that goes with the disease.
Is there a solution prior to of noticing an individual who may be becoming addicted to some of these pain medications that we're seeing, you know, that other people can start to say, listen, something's not right here?
Yeah, so we have I have a methadone clinic, and I have, in 1 year, I have now over 350 patients in 1 year. And there's probably another 2,000 patients in Ottawa. So what we have to do is firstly be aware that the problem exists. Addiction is out there. Opiate dependency is huge. Myself, I am empathetic to that situation, and I realize that these people need my help. And once you identify the problem, then you need to look for the solutions. And as physicians, we need to help. and as healthcare professionals, we need to help. So out there, the awareness is the most important thing. If you have the problem, you need to ask for help, and my number will be available to get help. And then you have to help support this process of changing the government's idea of putting people in jail as opposed to helping them get treatment.
Well, there's the definite the stigma attached to it. The numbers are listed in terms of reaching out for help, the outreach, and changing the way we are looking at the solution, I think, is the biggest thing for you. Thanks for the information, and keep in mind this is a pretty tough situation when we are dealing with that many Canadians per year that are dealing with the addiction to prescription medication.
And the thing I could add is
yeah.
that this is a preventable disease. That's the most important thing, and people should stand up and say, we want the help. Okay, not just say, oh, it's too bad now, it's too late.
Great information. Thank you very much.
Thanks.